clock shows 7:30, so we are going to go ahead and start. Okay, so welcome to this Dressage for Kids Zoom. Just a couple quick notes before we get started. First of all, thank you very much to the Connecticut Dressage Association for their support of this program. Thank you also to Trafalgar Square Books for their sponsorship of Dressage for Kids. In fact, I think they have been a sponsor of Dressage for Kids since the very beginning, so thank you very much to them. They are sponsoring gift cards, so we will have a drawing at some point during the Zoom, probably closer to the end. So we will do a drawing for a $25 gift card to Trafalgar Square Books. Thank you also to Susan Siebert and Carol Baker for their help organizing the Dressage for Kids Up programming. Our next Zoom is going to be February 10th, and that will be with Dr. Allison Arnold speaking about mental toughness in dressage. Of course, check out the calendar. We have lots of great events and programming coming up. So also, if you could please keep yourself on mute, at least until the end. If you have any questions, please feel free to put those in the chat. We'll be checking the chat and pulling questions from there. And I think that's my notes. So we're very pleased to have with us tonight Dr. Vanessa Yang. Dr. Vanessa Yang is a board-certified veterinary ophthalmologist. She completed a residency at the University of Wisconsin-Madison and specializes in treating all animal species, including horses. Dr. Yang currently serves as an Assistant Professor of Ophthalmology at the Cummings School of Veterinary Medicine at Tufts University. Her clinical interests include microsurgery and glaucoma. Besides being a veterinarian, she enjoys traveling, rock climbing, and spending time with her husband and with her dog, Scooby. So welcome, Vanessa.
Hi, everybody. Thanks for spending your evening here with me. So we'll be talking about some fun facts about the equine eye. Mary already gave me a very kind introduction, but just like a quick educational background, just so you kind of know a little bit more about me. I am from California originally, so I did my veterinary school training in Southern California at Western University of Health Sciences. I did 2 internships after that, one in Boise, Idaho, and another one in Long Island. I did a 3-year ophthalmology residency in Wisconsin, and I've been here at Tufts for the past 2.5 years as an assistant professor. So tonight we'll talk about eye anatomy and some features that make the equine eye unique. We'll also discuss equine vision as compared to our own vision, and I'll answer some common questions that we get concerning eyes. So this is external anatomy of the horse. Should look fairly familiar to most, if not all of you. So we've got eyelids, upper eyelid is up here, lower eyelid is down here. In horses specifically, they only have eyelashes on the upper eyelid. They don't have any on the lower eyelid. What they do have is upper and lower eyelid whiskers. So whiskers here, whiskers there. From the outside, you can also see the cornea, which in health should be clear, so you don't really notice it very much. But that's where the reflection comes from in this image here. There is a third eyelid as well. In health, you often don't notice the third eyelid either. In this particular horse and in many horses, it is pigmented. So it's this little triangle of tissue right there in the inner corner. And also the iris, which is kind of what gives you your eye color. So that brown kind of color for this particular horse. Moving to the internal anatomy. So if this is a horse's eye cut in half, so the cornea is labeled here on the outside, which is this clear tissue here. The iris is this brown tissue here. And then, so if we look further in, the next structure that we see is highlighted by the yellow arrow, and that's the lens. It does have a little bit of a yellow cast to it, which we'll get to in a moment. We'll also see this really beautiful kind of shiny greenish bluish structure here called the tapetum lucidum, which again we'll cover in a second. And also the optic nerve head, which is that little white dot down there. at the white arrow, and that's where the retina kind of joins together and starts to form the optic nerve that goes to the brain. If this were a physical presentation in person instead of virtual, I would pass around these little jars with the eyes inside so that you could compare the sizes of eyes between species. So there's a dog eye and a horse eye, and you can obviously see the horse eye is much larger. And horses actually have one of the largest eyes of any mammal that lives on land. This is just another comparison of how large a horse eye actually is. So this is a to scale comparison of a horse eye next to a tiger's eye. And so in general, equine vision is considered to be fairly good, and this is partially due to how large their eye is. Different species will have different adaptations for pupil shape and size. So the pupil is a part of the iris that kind of forms this hole in the center, and this hole or the pupil can change size and shape depending on how much light you want to enter inside the eye. So dogs and humans have a round pupil, cats have a vertical slit pupil, horses have this horizontal elongated pupil, and this gecko, just for fun, has this vertical slit pupil that has kind of these multiple 4 little diamond openings. Most species have the ability to change their pupil size in response to how much ambient light is outside, and horses can obviously do this as well. So this changes the amount of light that is allowed to enter inside the eye and hit the retina and form an image. So in bright light on the picture on the left there, you can see that the pupil is quite small to kind of restrict the amount of light. It's very, very bright outside. And then on the right, this is what a pupil might look like in the dark. So you can see the pupil is much, much, much larger in the dark, and that allows more light when it's dark outside to hit the retina and form an image. Horses specifically as a species also have some unique adaptations for existing in both bright light and in dim light conditions. So this covers some bright light adaptations. So horses do have a structure called the corpora nigra along the pupil edge. So that's kind of these brown cystic structures that kind of live in the middle top part of the pupil there that kind of hang down over the pupil opening. And so in my mind, this functions almost like wearing a ball cap on a sunny day, or if you're driving, if you're flipping down the sun visor, it's very, very bright outside. So you can still see, but it's just not quite as bright, quite as uncomfortable to be outside all day in bright light. Another adaptation that horses have for living outside in bright light is this yellow cast to their lens. So this image on the left here is the same image that we've seen before. If the green arrow is showing you the direction that the light travels from outside the eye to inside the eye, before it can hit the retina all the way in the back, it has to pass through this lens. And so this lens is actually a little bit yellow and yellow tinted to almost like filter out the blue light. So in my mind, it's almost like wearing yellow tinted sunglasses to help in bright light conditions to reduce glare. In terms of adaptations for better vision in darkness, horses also have better night vision than people do. This is partially due to the structure called the tapetum. So this is the structure that actually gives horses their eye shine. If you're taking a flash photograph of them outside in the dark or something like that, you kind of get a flash of green or yellow or something like that. That's due to that reflective tapetum structure that's in the back. And this essentially acts like a mirror kind of on the back of the eye, such that the light will hit the retina 2 times, and that doubles the amount of light that the eye senses. And so this is obviously very helpful in dim light conditions. We'll move on to talk about equine vision. I will preface this by saying that vision assessment is highly objective for us interpreting what another species sees, right? So we can't ever really truly know how another animal perceives the world, but we can use science to the best of our ability to make an educated guess. In order to make this topic kind of more relatable and a little bit easier, obviously, we'll use our human vision as the comparison. This also begs the question, why do we care? And we care because we have so much control over the environment in which our horses live. So we try to design these environments with our horses in mind, but they're designed by us from our perspective using our vision. So the more that we can understand how horses perceive their world, the more that we can improve their husbandry, we can improve their welfare, and we can even improve their performance. So what is vision? Vision is actually quite complex. It's a complicated amalgamation of many, many different parts. So some of those parts are listed here. Light, we've talked already about light, dark. Other things include color vision, perception of motion, visual acuity, or kind of the clarity or sharpness with which you see things, and also processing in the brain. So your brain does have to interpret what your eyes see. So like, for example, say you have like a concussion or something like that. Vision is commonly abnormal when you're concussed, right? You have blurriness, you have double vision. That doesn't necessarily mean that there's something wrong with your eyes, but your brain is not necessarily processing information normally. So that's a big part of visual perception as well. We'll start by talking about visual fields. When you think about your own eyes or your dog's or cat's eyes or something like that, our eyes are generally set very forward facing and they're set pretty close together. Horses have fairly laterally set eyes, meaning their eyes are set kind of on either side of their head on left and right. So that does give horses a very, very large visual field, meaning they can see almost 360 around them. And so in this image in the right here, this gray kind of circle area around the horse is all the area that they can actually see. Broken down, binocular vision is the vision that uses both eyes at the same time. And this is partially what contributes to having good depth perception. So in comparison to their entire visual field all the way around them, they have binocular vision for a relatively small area directly in front of them. Most of the visual field for horses, they actually use monocular vision, so vision using only one eye, so either the right eye or the left eye. And this monocular vision extends for most of the way all the way down the side of the horse. And lastly, the area kind of right next to their blind spot behind them is their kind of very, very peripheral visual field, meaning they do have vision back here, but their vision is more poor. They may only be able to detect motion, light, dark, things like that. So when we put all this together, what does this mean? It means that relative to us, horses are always seeing in this kind of panoramic type view all the way around them. So for example, when this horse has its head down and is grazing, he can use both eyes to look right in front of him, which is that area denoted in green there in his binocular visual field. But his monocular vision is able to see almost all the way around him, which is that arrow in blue. Evolutionarily, this makes a lot of sense. It is very helpful in that horses are prey species, right? So they need to be constantly watching the horizon for predators, making sure there's nothing sneaking up on them while they're having their head down and eating. However, because their peripheral vision isn't great, they're going to be reactive to motion back there because it's going to be unknown stimuli. And motion out in that periphery might stimulate their kind of fight or flight type of response. And finally, if you are familiar being around horses, you already know they have a couple of blind spots versus a blind spot that's directly behind them, which I think makes sense. They also have another small blind spot that is perpendicular to their forehead and another one that's right below their nose. So functionally, what do these blind spots mean? On the left is a horse being ridden on the bit so that his nose is being pointed kind of vertically downwards. There is a blind spot that's highlighted in yellow that's perpendicular to his forehead there. And so in this position, when the pole is flexed, the blind spot is right in front of him and the horse is more dependent on the rider for guidance. And then on the right-hand side, when the horse raises up its head, because there's maybe a potentially distant scary object or motion or new noise or something like that. Essentially what the horse is doing is moving its blind spot up and out of the way so that that new stimulus can be within his line of sight. Color is an important component of vision as well. and horses' color vision is different than ours. The ability for any species to see and discriminate between colors is due to special cells in the retina called cones. They're called cones because they're kind of conically shaped at the tip of them. Humans, or most humans, have 3 different types of cones. They come in blue, green, and red. And when these 3 cones work together, they kind of blend and give us all the different color combinations that we can see. Horses only have 2 different types of cones. They have a balloon cone and this kind of combination red-green cone. And so because they have fewer types of cones, this means that they have fewer color combinations that they can see. This is a computer simulation of the color wheel. So for humans, we have trichromatic vision. It's 3 cones. And so this is kind of the whole color wheel of all the things that we can see, like the whole like Roy G. Biv colors of the rainbow spectrum of color. Because horses only have 2 cones, they can only see things really in shades of yellow, blue, and this kind of in-between grayish type color. And so if we were to compare their color vision to a human's, it would be similar to a person that has red-green color deficiency or partial color blindness. These are some more color simulated images from the same publication of what we see versus what horses see in terms of color. And so in this image here, we can see the white of the building is still white. But I think the most striking thing about this set of images is that grass isn't really that green to horses. So you can see for us, obviously grass is green, right, in panel A. But grass in the field out there is kind of more this yellow color to horses. Another color simulation comparing human color vision and horse color vision. So if we look at this girl's pants, her pant color still appears blue. And if we look at the horse side, although it is kind of a more muted, less bright blue, it's still noticeably blue. But if you shift your attention to the girl's jacket, instead of being pink, horses don't necessarily see pink, right? It comes out this kind of blue-gray color. So functionally, what does that mean? If you are trying to make something stand out to a horse using color, we can't necessarily pick the colors that stand out the most to us. So this is something to consider for their housing environment, but also their training and sporting environments. So these images are taken from a study that examined different fence and hurdle colors used for jump racing in the United Kingdom. In the left, in the human column, that's how the colors appear to us. And in the right is a simulation of what they may look like to horses. So traditionally, these fence and hurdle colors, they were orange. And although orange stands out very vividly to us, it doesn't necessarily stand out well to horses, and it doesn't contrast well against the surrounding materials, so the grass, the turf. The other colors that this study tried were white, the fluorescent yellow color, and blue. And so they came up with these different color simulations, and they also performed jump trials with horses using these different color fences. And fence color was shown to change the way a horse jumped the fence. Specifically, they looked at variables like the takeoff distance, landing distance, and the angle of takeoff. They did test other variables as well. So they tested wood materials. They also tested like a glossy finish as opposed to a matte finish of the fence material. Other thoughts would be instead of a solid color, a fence with a contrasting color may be easier for a horse to see. So instead of being solid, being striped. So this is a great example of how vision science can be used to improve horse and rider safety. This study was actually funded by the British Horse Racing Authority. And after the study came out, the UK switched their hurdles and fence colors from orange to white instead. Although in the image panels, it looks like the fluorescent yellow does work quite well as well. They didn't end up using fluorescent yellow for practical reasons, so it kind of faded very quickly out in the field. Acuity is also another component of vision. So visual acuity is the ability to see objects and details without blurring. So it's kind of it's fine detail and kind of clarity of vision. For people, this is most commonly tested using the Snellen eye chart shown here on this slide. And so this is where you stand at a fixed distance away from a sign on a wall, so it's 20 feet. And then you see how well you can read the smaller and smaller and smaller and smaller letters. And so we consider a visual acuity of 20/20 as quote unquote normal in people. There's a couple different ways to test this in horses. And based on these different types of testing, quote unquote normal horses, they fall somewhere between 20/30 and 20/60. And this is actually better visual acuity than dogs or cats. So you've seen these images before. Ignore the color part. These images were also adjusted to take into account the decreased spatial acuity of the horse. So you can see for the human, the image is a little bit more crisp, and for the horse, the image is a little bit more blurry. This is a still taken from a video simulation of what a horse might see as compared to their rider. I'm gonna try to share this video. It's kind of just interesting. I don't know how scientific it is, but it's kind of just an interesting thing to think about. So rider's vision is up top. Horse's vision is kind of in the center there. So you can see the color is obviously very different. There's more panoramic visual field for the horse. They kind of simulated that little blind spot up here in the front as well. The colors of the flowers will look different. And then getting into a more darkly lit area, horses will have better night vision than people do. Since they have that blind spot kind of right under their nose, they have to adjust head position to kind of get a view of that bridge there. The simulation also kind of blurs the vision a little bit more at the periphery, right? So we talked about their peripheral vision is not quite as good as the vision right in front of them. Adjusting to changes in light dark. So yeah, not sure how scientific that was, but kind of just an interesting way to view equine vision, I thought. That was created by a facility I cannot pronounce because it is French, but they're located just outside of Paris. It's a stud farm kind of training facility. Moving on to some common questions that we get about horses and eyes. A lot of people just ask, like, what are preventative things I can do? How can I keep my horse's eyes healthy? The first thing I have listed on here is a pre-purchase exam. So if you're ever thinking about buying a new horse, we always strongly recommend that you get a pre-purchase exam that includes the eyes. You just don't want to be surprised by an eye problem later on. And it's always very helpful to have a baseline eye exam that you can compare to if a new eye problem does come up in the future. Also, just making sure that the eyes are checked once or twice a year whenever your vet comes out to do routine physicals, vaccines, etc. Catching eye diseases early will significantly improve your outcomes and potential vision, that sort of thing. We Talked about some adaptations that horses naturally have against the sun, but UV protected fly masks are still very helpful. This can be protection against the sun, protection against snow glare, can keep some allergens away from the eyes, reduce dust and pollen load, etc. They should still be removed once a day at least so you can see the eyes. Horses can still injure their eyes under the fly mask. But it's also very helpful to have a UV fly mask, especially if your horse is predisposed to things like ocular squamous cell carcinomas of certain breeds, halflingers, Belgians, etc. Are more likely to have some UV light-induced cancers that form around the eyes or on the eyes. Or even if your horse just happens to have light coloration around the eyes, UV masks can be helpful as well. Just take a look at their eyes daily. Anything that you would do if your eye was bothering you, a horse would probably do too, right? So if something was bothering you, you may hold your eye closed a little bit. You may have some eyelid swelling, some tearing, some cloudiness. If you ever see these things, just call your vet right away. It's difficult to know exactly what's going on based on those symptoms alone because many eye symptoms of different diseases all look outwardly the same. And so a horse with tearing can have something kind of simple and not emergent, not vision threatening, something like a blocked nasolacrimal duct, right? But a horse with tearing can also have a scratch on the surface of the eye or corneal ulcer, which can be more serious. So we always just say, just err on the cautious side. It may not be just simple allergies, and many eye diseases can change quite quickly. So it's always better to call your vet for a problem that isn't very serious than to wait too long and have something serious kind of fester and go on for longer. People will also ask about supplements for eye health. And while there are certainly studies on individual ingredients that might be part of a supplement, I'm not aware of any studies that look at any specific supplements, combinations on live horses. I don't think there's well-established doses for the ingredients and supplements. We don't know that much about how well they're absorbed and that sort of thing. So although, yes, you can give eye supplements, they're probably not going to hurt. I can't necessarily guarantee that they're going to help for any specific eye condition. If you brought your horse to an ophthalmologist, how are we going to evaluate eye health? So I've put some equipment on here that we may use during our eye examination. The first image up there in the white is actually a handheld microscope. We call it a slit lamp, and that helps us do an eye exam of the front half of the eye. We will use some different equipment and also look at the back half. We'll have other equipment to look at the retina, the optic nerve, and the tapetum and that sort of thing. We may or may not need to dilate the eye, just like if you or I were at the eye doctor to get a better look at certain structures. If you were referred to a specialist, there's also some additional testing that we can do as well. So retinoscopy is also called refraction or called skioscopy. So that is essentially looking at what your glasses prescription would be. So we obviously can't have horses say, number 1 or number 2 and kind of pick. But there's some manual ways that we can determine if a horse is nearsighted or farsighted or neither. And fortunately, most horses have normal vision. They're neither farsighted nor nearsighted. Sometimes we do our eye exam and the eye looks completely normal, but the horse may still be exhibiting some visual changes. And so we may do an electrical test called an ERG. Essentially, I describe this almost like doing an EKG of the heart, right? So for your heart rhythm, you can put some leads on your chest. Those leads will kind of lead to a computer and you can see a waveform of your heart activity on a computer screen. We can do the same thing for the eye. So we can put some leads around the eye, we shine some lights in the eye and we see, does your retina normally function and have these normal waveforms that pop up on the computer? Eye pressure testing may also be part of a normal eye exam as well. So that's in this image labeled B down here, such as taking an eye pressure for a horse, because either high pressure or low eye pressure may indicate some diseases as well. We are often asked if an eye problem is the cause of undesirable behaviors. like spooking or head shaking or other causes of poor performance? The answer is sometimes yes, and sometimes no, and sometimes frustrating maybe, or we don't know. One common example for referrals that we get for potential kind of spooky or head shaking behaviors would be these corpora nigra cysts. So we talked about the corpora nigra acting as either a ball cap or a sun visor, and they can get cysts as well. Corpora nigra, I kind of talked only about the upper ones. There are some small lower ones too. So in this picture on the left-hand side, at the green arrow, there's obviously a cyst here along the lower corpora nigra. They can limit vision. You can imagine having that kind of big bubble of tissue, especially when the pupil is very small in bright light conditions. And so it might be limiting vision and kind of that half of the eye. Presumably they move around a little bit during normal movement, and that can be bothersome. Fortunately for this particular problem with the corpora nigra cysts, we can easily deflate the cysts with a laser, and a good percentage, about 85% of horses that have behavior problems with a cyst, owners will report that there's improvement in these behaviors. Other eye problems can be more difficult to definitively determine if they're the cause of unwanted behaviors. So although this might seem like a simple question, it's important to understand that there's not any standardized, universally accepted test to determine if a horse has impaired vision. And if we do believe that a horse has impaired vision, it's hard to quantify that completely. So how impaired is it? We can more easily tell you if a horse is completely blind, and we kind of speak in generalities, but I can't necessarily tell you if your horse has 45% of normal vision versus 15% of normal vision. I'm not going to be able to do that. This is also a little bit complicated by the fact that horses often don't have a baseline eye exam from before the behavioral problem started. And so if we do an eye exam and we find some minor changes, I wouldn't be able to tell you if these changes are new or old. And so I can't necessarily link them to a specific behavioral problem. This kind of goes back to the importance of doing a pre-purchase exam as well. There was a recent study that looked at horses that were 15 years or older, and they polled the owners and they asked how many of them thought that their horse had an eye problem versus the number of horses that actually had an eye problem after they were looked at by an ophthalmologist. So only 3% of horse owners thought the horse had an eye problem. But when an ophthalmologist looked at them, 88% of horses actually had some findings on their eye exams. And so kind of the big takeaway from that study is, if we're examining a horse that's a little bit older, we're probably going to find something, right? Most of these findings are going to be minor, like a small amount of cataract or a corneal scar or something like that. But it kind of just goes to show, like even if we find something on our eye exam, it can be difficult for us to say definitively, yes, this is a problem, or no, this is the cause of the behavioral problem. The flip side to that question is, if you have a horse that was performing well and then was diagnosed with decreased vision for whatever reason, how does that impact their performance? Can they still be used? There was another survey on horses diagnosed with uveitis, which is a common cause of vision loss. And in these horses with uveitis, less than 40% of horses were able to perform in the same discipline at the same level. In general, this question is very individual to the specific kind of horse and rider scenario. It depends on the horse's use. It depends on how much training the horse had prior to vision loss. It depends on, the horse's individual temperament, the rider's comfort. Depending on what the diagnosis is, your vet may or may not recommend that the horse not be used anymore. And we make these recommendations both with the safety of the horse and for the safety of the rider in mind. There are some examples of horses with vision loss that are able to compete at very, very high levels. So on the left, there is a Hanoverian mare named Viscera. She lost her eye due to uveitis. And she and her rider were able to represent their home country of Sweden in the Tokyo 2020 Olympics in eventing. So one example of a horse that was performing at a high level, lost an eye, and was able to continue performing at a high level. There's also been a handful of horses with one eye that have run in the Kentucky Derby. So Patch, which is imaged there on the left, he ran in the Derby in 2017 and he lost his eye from an ulcer. So it is possible. In most cases, we will expect that there is some decrease in performance or change in discipline associated with that vision loss. And that can depend on the severity, but some horses can be still very successful at what they do. And sometimes, no matter what we do, we still lose vision in both eyes for a horse. And how do I care for a blind horse? Obviously, if a horse loses vision in both eyes, there's going to be an initial adjustment period, right? The horse is going to have increased fear, increased anxiety, and therefore, because of those factors, increased unpredictability. The ability to adapt to a blindness, that will be also inherent on the temperament of the horse and in part the dedication of the owner. Some horses can end up adapting very well to blindness, while other horses will not adapt well. For the ones that can adapt, the most important aspects of managing blindness is safety. So that means safety in the environment. So making sure there's no ice patches in their environment in the winter times, making sure that the stalls and the fences, doors, that sort of thing, don't have any sharp projections, not leaving obstacles out in their environment that aren't normally there. So things like mounting blocks, removing tree branches that hang down lower. If your horse has been diagnosed with partial vision impairment and has a diagnosis in which they will probably eventually go completely blind, you can start making some of these environmental adjustments while they still have a little bit of vision so they can kind of learn and adapt to their new environment before they lose their vision completely. Predictability is also an important component of managing a blind horse. So whether that's in their environment or in their daily routine, so feeding at the same time, et cetera, et cetera. Horses are obviously very social. And so what you want to make sure of is carefully picking a social partner for them to live with. You don't want a pasture mate that is very dominant or kind of a bully that limits this blind horse's access to food or water or shelter. A single buddy horse that is kind of calm, they get along well, is something that's pretty important for them. They can wear bells so they can always hear where their buddy is at, etc. And also just using other senses to communicate with your horse. So that means a lot of new verbal commands and talking and that sort of thing. And finally, most people will probably know this answer, but when is an emergency? You know, like when should I not wait to call a vet or go to referral practice or something like that? And these are some examples. So the horse here on the left obviously is in some discomfort, right? Is squinting, keeping the eye partially closed, maybe has a little bit of swelling of the upper and lower eyelids, has a lot of tearing discharge, right? That's kind of spilling down the face. The cornea is super, super cloudy, right? So this is an emergency. The middle picture here, this is pretty obvious. This is an eyelid laceration. This needs to be repaired very quickly. Horses don't have a lot of spare extra eyelid. And so if this is left to heal on its own, it's not going to heal well. And fixing these very quickly is better for outcome than, you know, waiting a day or two. Changes in symmetry can also indicate an emergency. So this picture in this top picture here, obviously the eyelashes are pointing in different directions, which people often know is a sign of ocular discomfort in horses. But also notice that the eye on the horse's left or horse's right hand side is also sitting down a little bit lower than the normal left eye. So this horse actually has an orbital fracture. So these might be signs to see someone immediately and not wait. these are some sources that I used for the talk today, and I'm certainly happy to take any questions that anybody has.
Okay, so I do see some questions in the chat, and we also had some questions sent in advance. So, okay, so just a couple questions. Can you talk a little bit about horses' depth perception?
Yeah, so generally we think of depth perception as, I guess I'll back up in the slides a little bit so you can all just look at the same thing. Sorry if this is giving some sickness as I go backwards. So generally, we think of depth perception as being associated with binocular vision. So vision from both the left and right eyes put together. And because the left and right eyes are in slightly different positions, we get kind of two different perspectives between the left and right eye kind of combined together. And that's how having two eyes is helpful for depth. Depth perception is not solely related to having two eyes though. So just because a horse has one eye does not necessarily mean they can't tell depth at all. Their depth perception will be different, but doesn't necessarily mean it's absent. So there's other kind of environmental cues that you can use to assess depth as well. I don't know if I have a great picture in this presentation for it. So you can kind of use environmental cues as well. So in terms of like distance, for example, if you're looking along a fence line or something like that, like based on where objects are along that fence line and their size in relation to each other, you can also have a form of depth perception as well. So although depth perception generally is best with two eyes, it's not that one-eyed horses don't necessarily have any depth perception. Hopefully that's helpful.
Okay, and then I know you touched on it a little bit, but can you talk a little bit about as horses age, kind of like what typically might happen to their vision in addition to what problems might occur?
Good question. So as horses age, the most common things that we might see are a little bit of age-related cataracts, which typically don't progress to kind of full-blown cataracts. They kind of just fester there. They don't progress to inhibiting vision completely. Generally, as humans age, our ability to accommodate or the ability to see both kind of near things and far things in focus declines over time because our lenses get a little bit more hard and a little bit more firm. Horses don't accommodate very much anyway. Their accommodative ability, so ability to kind of focus both near and far, is fairly limited as compared to humans. And so while they may happen to them a little bit, it probably doesn't bother them quite as much, right? They don't necessarily need readers as they get older. There are some changes in their retina that happens over time as well. So we'll call this senile retinopathy. And so we can see little changes in their retina as they get older, but typically we don't think of those changes as necessarily causing significant vision loss or blindness or like that. So there's some kind of common, quote unquote, more normal age-related changes that we see in the eye, but it shouldn't necessarily be vision threatening.
And are there certain ages where like you would expect to see start to see changes, or is it kind of dependent on the individual horse?
Yeah, like in their mid-teens, maybe a little older, we'll just say, look, there's a little cataract, you know, we don't do anything about that. We see this and that. We don't necessarily do anything about that. The lens also tends to get a little bit more yellow and a little bit harder with age. And so over time, the lens acquires even more of a little bit of a yellow cast or brown cast, which we call brunescence, which we commonly see in horses as well.
We had a question, how long does it take for a horse's vision to adjust from light to dark? For example, if they're outside going into an indoor riding arena?
That is a good question that I don't have like a, 12.4 I don't know exactly how long. I know the theory is that they may take a little bit longer to adjust than we do. I don't have a specific number in mind. I can certainly shoot you an email after I do a little bit of homework.
Sounds good. And then when you were talking about the cysts, would those be visible to like the naked eye?
Yes, I'll go back to the cyst image. So if they're quite small, you may not necessarily notice them. Some horses may also have multiple cysts. Again, they can be on the upper or the lower margin of the pupil. Once they get large enough, if you shine a light, even just like your cell phone light or something like that in the eye, you'll be able to see it quite easily.
Okay. What are some signs that your horse or pony might be having trouble with their vision?
Those are usually questions best answered by you guys, right? Because you guys spend the most time day to day with your horse and know what's normal versus abnormal for your horse. So if you're seeing things that have kind of changed slowly over time, more hesitancy to do this or that, spooking about this or that, those are subtle things that you guys can probably pick up on that we may not be able to. Um, the issue with those changes in behavior are that they're not specific to vision necessarily, right? So that might indicate some discomfort orthopedically or other behavioral changes. So they're not necessarily specific for vision, but those kind of first early signs that something's not quite right is best detected by you guys. Once the vision loss becomes very obvious, it's usually kind of too late, right, to do something like that. So if you are noticing kind of subtle changes, it's important to have your vet come out and do a full exam that includes not just the eyes, right, but also like an orthopedic exam, et cetera, et cetera.
Can you talk a little bit about any like immune related changes to the eye or, seasonal allergies and how you kind of differentiate or treat for those?
Um, the kind of most vision threatening, presumably immune mediated disease is equine recurrent uveitis, right? So this disease can be very difficult to treat, causes inflammation inside the eye. The eye can only withstand so much cumulative damage, right, before it stops functioning very well, right? So uveitis kind of does a little bit of damage, gets better, gets a little bit of damage, gets better, does a little bit of damage, gets better. But each time that happens, the eye functions less and less well. And so that type of immune mediated damage can be difficult to treat, can certainly help you with that. That's kind of the first thing I think about with immune mediated eye problems that are vision threatening. And we'll treat that with immunomodulatory medications, right? So topical steroids, topical NSAIDs, sometimes medications by mouth, et cetera, to help modulate the immune system's reaction inside the eye. In terms of seasonal allergies, we touch on that a little bit with, like if you have a little bit of tearing, this and that, is it allergies? Is it something more serious? That's not typically a problem I see very often, right? That's something that your family veterinarian typically can diagnose and take care of for you. I generally kind of see the more serious immune-mediated stuff like equine recurrent uveitis.
Okay. I do have one more question that had come in earlier, but just for those of you that are on still on the call, if you want to continue putting questions in the chat, I will keep pulling questions from there as well. So actually, on the topic of uveitis, why don't we take this one? Is there anything that can be done to prevent uveitis in horses prone to the condition?
That is a tricky question because we think that there are so many different triggers for it, right? We think that there might be a heritable component since we see it much more commonly in certain breeds. We think that there might be some sort of infectious component, right? Because infection with the bacteria Leptospira is suspected to maybe trigger some of these things. And sometimes we never really know what the underlying cause is. In general, we would say, keep your environment free of, because Leptospira is a bacteria that is excreted in urine of like certain rodents and that sort of thing. We just say like, keep a clean environment, right? Free of rodents, change out their water, et cetera, et cetera. For these heritable kind of genetic type of things, it's very hard to know if there's something that can be preventative. I may sound like a little bit of a broken record, but we will often see horses with very advanced uveitis where the owners were like, I just thought it was allergies, right? Like I just see tearing every now and then. He squints, for a day or two, and every now and then it kind of clears up on its own. So if you are seeing those symptoms, getting a vet to come out and just kind of checking for these more subtle earlier signs is important for maintaining vision for the long term.
Okay, and then I know you touched on it when you were talking about like the eye chart and just looking at the physical structure of the eye. But what are some of the, like as a vet, what are some of the things that you're looking for to tell whether they're more on the normal end of vision or if they do have some vision loss?
So we can do maze tests, both in the light and in the dark. So if a horse is in a new environment, how is it navigating and interacting with its environment? When I do my eye exam, if I have a hard time seeing in and seeing the retina, presumably the horse also has a hard time seeing out, right? So if the cataract is very small, I can see everything I need to see. Presumably it's fine, right? If the cataract is impairing my ability to see the back of the eye, it's probably impairing the horse's ability to see out. And so we kind of use those cues to help us kind of guesstimate essentially how bad the vision impairment is.
Okay, I think we will leave it open for one more minute, but I think we've covered most of the questions. Okay. All right, last call for questions. If you have any, please write them in the chat. Okay, I have seen some eye washes at the tack store. Would you know if these are safe or not?
Generally, the fewer the ingredients, the better, honestly. So as long as it's sterile, which it's probably going to be sterile. Typically when we do eye wash or something like that, it's really just a sterile saline and maybe like a little bit of a preservative or something like that. You don't need anything super fancy if you're just trying to ridge something out of the eye.
Okay. And then I know we have another question about kind of the light going into dark scenario, which maybe is good for a follow-up email. But just a question about like if you're going into an indoor and you want to jump a course, how long you should wait for the horse's eyes to be adjusted before you're jumping a course.
It shouldn't be like a prolonged period of time. But yeah, I can see if there's any. I'll try to get you a number and I'll shoot you. But yeah, it shouldn't be like a prolonged period of time that you have to wait.
Okay. We'll follow up with that one. And then do blue-eyed horses have, like, are they more prone to issues?
That's a good question. So depending on the horse, sometimes the lighter colored irises, owners will report more light sensitivity. That is sometimes because as compared to a horse with a brown iris, so ignore the cyst for this image, but having a brown iris instead of blue iris, the iris can actually be a little bit thicker in a brown-eyed or a brown irised horse as opposed to blue. Sometimes the horses with blue irises, because the iris itself is quite thin, their pupil may not be able to constrict quite as much and block as much light. And so sometimes I've heard in the more severe cases that the horses actually are more light sensitive. Other times it's not necessarily the fact that the iris itself is blue, it's more that the pigmentation around the eyelids is less pigmented. So instead of being very brown on the third eyelid, brown on the upper and lower eyelids, it tends to be more white. In those cases, those horses are more likely to get UV light induced diseases, like squamous cell carcinoma and that sort of thing. And so those horses may benefit more than your average horse from UV protection.
Okay, well, I think this has been a wonderful presentation, and we really appreciate you being here and sharing all this information with us.
It's very fun for me to spend my evening with you guys. Thank you for having me.
I don't know if you can see the chat, but lots of thanks are coming in.
Great. Have a good night, guys.
Okay, thank you.
Thank you.